it's really a new beginning in Ottawa. We've been talking about racism and the health of African Canadians, and today to be here to actually recognize a day for us to come together and have a collective voice is really exciting for me to be part of this. And so I just want to say this is a day that actually, again, increases the motivation for many of us who have been talking about health. As Suzanne just mentioned, we recently formed an organization called Canadians of African Descent Health Organization, CADO. And this stems from the number of projects that we've done, and time again we come up with results that points to racism as a key determinant of health for us. Mm-hmm. I am not going to repeat what my colleagues and friends have just outlined here very beautifully. The councillor talked about the need for data. We've been talking about the need for systematic collection of data. I remember about 15 years ago doing actually postdoctoral fellowship with Health Canada at that time. And again, I kept going to meetings with CARHI, the Canadian Institute of Health Information. When are we going to collect race-based data? Every time you go to these rooms and you continue to say this and you feel like it's falling to deaf ears because you leave and nothing seems to happen. And we've decided, okay, we'll put it in textbooks. In 2009, I published a textbook called Anti-Racist Healthcare Practice. Some describe it as one of the first in the Canadian literature to actually name these things. We have it being used in nursing schools across the country to talk about anti-racism and frameworks for addressing it. And still we continue to see the lack of data. And so I would really like to highlight on the points that you just raised, Dr. Sanel, the need for data, the need for us to pride ourselves in using evidence in whichever aspect of this work that we're engaged in. How can we make sure we have race-based data that can help in program planning? How can we make sure that we have race-based data that can improve the curriculum content of our professionals that are being trained to deal with Black people, whether it's our physical health, our mental health, because we cannot today address mental health in isolation like you've highlighted. Mental health, the health of our mind is very related to the mind, the health of our body. Mm-hmm. And we have to have an integrated approach, a collective approach that involves authentic involvement of community leaders, faith-based leaders, so that we're dealing with our mental health, we're dealing with our spiritual health, we're dealing with our physical health. Because when you, like the examples and some of the things I've heard here, they are all interconnected. Mm-hmm. When you go to school and you cannot afford to pay your school fees, or you cannot afford to do well the way your other peers are doing because you have bad housing situation, because you have many other things that is disturbing your family, then it impacts on your mental health. So mental health is actually the result of the many things that we're dealing with in our different families. This Christmas, I went to a Christmas event where a young Black boy got on stage and literally was begging for money to pay his school fees. He said, I'm in third year medical school and I have not been able to continue my program because I cannot pay my school fees. We were collecting data at this particular event. So some of my staff that were there collecting data funded by, again, we're looking at HIV and monitoring in the Black community at that time. People started donating their honorarium. The petty cash we give to people was being donated to these boys' tuition at this event. So you can imagine, I left that event, the mother of this child wrote to me and said, I'm praying for help, anybody that can help my son. So those are some of the things that impact on the mental health of some of the things of the people we're talking about. And we need to think about a collective effort. I'm looking at today as a window that opens the door to that house, the house where the wicked determinants of Black people's health is housed, where we can begin to look at every room in that house and begin to unpack them and see how we can deal with each of these issues, including our lack of leadership presence at policy arenas. Mm-hmm. We go to many of these tables. If you're there alone. Mm-hmm. You make a point and you're waiting. Who is going to take this point up, especially when you speak with an accent. You make this point, and it's like, did anybody hear that? Did anybody hear? You know, and so. And so we need more presence and more authentic engagement. How can people begin to recognize the skills, the knowledge that we have when we sit at this table, irrespective of how we look, how we dress? How can people begin to recognize the talent we bring to this table? So I really want to encourage all of you to come together. We're hoping that this cadeau organization, which in French means gift, they gift to our community. We're hoping that this can be a gift for a collective dialogue, for us to actually engage in an integrated effort to address Black health issues as a whole. So thank you.